Hi, this is Wendy Wood. I'm going to be recording a mini lecture on orthopedic and postural concerns in the older adult. And first, I want to talk about strength losses that occur. Those losses occur mostly in the type 2 fibers. Remember, those are kind of the power fibers. Other contributors to strength losses include lowers, lower levels of activity, usually in the older adult, and decreased cardiovascular endurance. So, patients that have less stamina, older adults with less stamina, begin to do less, and then in turn, they have less strength. Poor nutrition may be a contributor, and also, the decreased activity level can result in the decreased neuromuscular connectivity. So you have slower impulses or slower reflexes. Also, the inhibition of muscle contraction from edema due to arthritis. So it's kind of that downward spiral sometimes where a person has pain and maybe swelling or edema. And then due to that pain, they decrease their activity level. Of course, the physical therapy role is one of the things to do is work on exercise to reverse the changes to improve overall strength, stamina, and the neuromuscular connectivity or reflexes. So even in terms of arthritis, when you're working with the older adult, you might want to work on balance training type activities. And then, of course, if pain is inhibiting things, the physical therapist can help with various types of modalities. The doctor might help with anti-inflammatories. So, in terms of flexibility, decreases occur in the older adult due to increases in type 1 fibers. So, those are the stabilizers, not the fast reacting. Also, decreases in elastin and increases in collagen, and then cartilage breakdown. So, flexibility is most lost in extension. So, I like this quote: extension equals function. I wish I knew who said that, but extension equals function. So, we do know in the older adult, we see them in more of a flexed posture. Okay, let's talk a little bit about osteoporosis. This is a musculoskeletal disorder of compromised bone strength that predisposes a person to increased fracture risk. And that is from the National Institute of Health. The contributors or the causes are due to losses in the cancellous or trabecular bone. And as we talk about where these fractures occur, we'll know that they're mostly where that type of bone is. Bone loss is greater for greater for women than men. And that is mostly due to hormonal influences, especially in women after menopause. So there's actually an accelerated bone loss of about 7% per year. Prior to that, it is about 1%. And the most common sites of fracture are the wrist, the hip, and the vertebral body. And it's typically the anterior portion of the vertebral body. But other sites could be the ribs, the pelvis, and really any bone in the body. The hip, it's the most life-threatening and disabling injury when fractures occur there. 20% die within that first year. Statistics show that about 6 months after fracture, 15% can't even walk without an aid. And we're really not talking about people having total hip replacements that are elective. We're talking about people that fracture their hip, they ended up having the total hip replacement or the ORIF. Within the vertebral body, in the spine, these are the bones that are the first to show signs of fracture, and it's primarily in the trabecular bone, and fractures occur during trunk flexion. Once someone has a fracture, the risk for a second fracture increases by fivefold, but only 20 to 30% of compression fractures are symptomatic. So, of course, these facts come from the National Institute of Health and the International Osteoporosis Foundation and the report of the Surgeon General on bone health. So, looking at the consequences of spinal fractures, one of those fractures or symptoms could be back pain. Here's a big one: height loss. So, very important that you're getting an accurate measure of your patient's height. Impaired ADLs, of course, is a functional consequence of that, and then increased risk of fractures and kyphosis. Sleep disturbance could occur due to pain. You may see a decrease in lumbar lordosis, more of a flattened spine, and a difficulty fitting into clothes, and the increased risk of death. That, overall, that's due to problems, sleep being disturbed and, kyphosis. Anxiety could be one of the symptoms. Other signs, protruding abdomen. And by the way, the signs don't exactly protrude to that exact category. So talking about the symptoms too: depression, decreased self-esteem, fear of falling, and decreased quality of life. So signs again: height loss, decreased lumbar lordosis, protruding abdomen, and that's again due to the change of the body from those compression fractures. Weight loss and reduced lung function. So that's due to the compression of that thoracic cavity, changes in the thoracic cavity. So again, functional consequences: impaired ADLs, difficulty fitting in clothes, difficulty bending and lifting, difficulty descending stairs, difficulty cooking. So some of the complications: bowel obstruction, constipation, inactivity, DVT, muscle weakness, loss of independence, increased thoracic kyphosis, and with that occurs a lot of pulmonary things. So we see atelectasis, pneumonia, pain, height loss, loss of self-esteem, and death. Diagnostic tests: the bone mineral density test is the gold standard. It's the BMD or the DEXA scan. X-ray is not a test of osteoporosis. T-scores. So you should know those. 0 to 1 is normal. -1 to -2.4 is actually indicative of osteopenia. Sorry about that. And -2.5 or less is indicative of osteoporosis. Okay, less than 2.5 and fracture would be severe osteoporosis. And what you're going to learn a lot of times is these fractures occur to very slight activity due to like minimal injury. Okay. A Z-score is a test that might be used in premenopausal women or men less than 50 years of age or children. Risk factors: age. So increasing age, of course. Women get more prone to fractures. We've talked about that because of the hormonal influences. Genetic makeup, body type, more of a thin build, complexion, fair and freckled. Race: whites and Asians are more at risk. It's actually in the African American race very rare. Osteoporosis is rare. Poor nutrition, inactivity, and smoking. Predisposing diseases: AIDS or HIV, ankylosing spondylosis, breast cancer, COPD, Cushing's disease, depression, diabetes, eating disorder, female athlete triad, loss of the menstrual period, eating disorder, and excessive exercise. So that results in more of a tearing down of the bone, osteoclastic. Gastric bypass or other gastric diseases because they affect bone absorption. Hypothyroid disease and kidney disease. Um, Further predisposing diseases, again, celiac disease, that affects malabsorption as well as other syndromes that might affect that. Multiple myeloma, MS, Parkinson's, post polio, poor diet, premature menopause, prostate cancer, rheumatoid arthritis, scoliosis, spinal cord injury, CVA, weight loss, and any condition that causes bone loss. So, first signs: fracture with minimal trauma, kyphosis, the loss of body height, transparent skin, I'm not really quite sure of that, periodontal or other dental disease. So, of course, there's bone there, and back pain and the protruding abdomen. Risk for fracture is if there is a history of a prior fracture. We've talked about that before. Vision problems, I would say that's because someone's balance is compromised. Deconditioning, balance impairment, thin build, hip fracture in the family history, inability to get out of a chair unaided, and being on one's feet for less than 4 hours a day. Clinical risk factors. So this is where you could be looking at, does the person have a body height loss? So sometimes, when someone goes to, let's say, the urgent care, they ask the person their body height and body weight. They need to be actually weighing the person and taking an actual height. Fracture with minimal trauma, too, as I mentioned. Management, exercise, called the E-pill. Medications are various different medications for osteoporosis, and diet, things rich in calcium, vitamin D. Nutritional factors. So things that are rich in vitamin D. This is kind of meant to be a discussion point, so think about those. But basically, things rich in vitamin D, things rich in calcium. The person needs to be not losing weight. Okay, so those are all important ways the person can prevent things. Nutritional factors might include supplements. Okay, thank you very much. That concludes this presentation.